60 years is a pretty remarkable milestone for any organization. CMHA, 60 years of services, 60 years of helping people with serious mental illness across the region. It's an organization that has, really celebrated a lot of milestones along the way, made a lot of accomplishments, and taken some very bold strides forward in helping people in this community. And what it's done, I think, is it's given us a base to grow forward.
When I first started at the Canadian Mental Health Association, the focus was on public awareness, advocacy, and coordination, which really laid an excellent base to affecting the change that was coming, which was really about what would be the best services and how would they be best delivered to be able to support the people with mental health challenges in the Ottawa community. One of the biggest change was really including consumers and the community into delivering services differently with the hospital closures. So case management, we had the first case management program. We had that move to a program focused on providing services in a case management format for the homeless. It built into ensuring that there would be housing available in the community where people could live permanently. It was the period of time where we moved away from transitional supports to permanent supports, and it was in a very short period of time where this revolution was really happening in mental health.
When I arrived at CMHA in 1994, there were, I think there were just a little over, somewhere between 16 and 20 staff at CMHA Ottawa branch, and there was a really strong focus on public awareness and social action, and a very small portion of the agency was direct service. We participated in a lot of planning with the Ministry of Health in particular and the District Health Council at the time, and we had the opportunity to really expand. So we decided that we would focus on those who were experiencing the most severe and persistent mental illness. They were those people who were in large part living in the emergency shelters, had been there for a long time, were not accessing traditional mental health services or institutional mental health services. It felt like they were living in crisis consistently or constantly, and there wasn't a focus on really looking at the full spectrum of their needs, from housing to mental health to social support, all of that. So we felt that we had a really unique opportunity, and we took advantage of it.
CMHA has really been one of the organizations here in Ottawa that has really incorporated the evidence-based practice approach. So CMHA has been a leader in really looking around the country and around the world at the best practices as they relate to community mental health, and figuring out how to incorporate those strategies or those approaches here, bringing them here, helping get other organizations engaged behind those strategies, and really evaluating the impact of those strategies on the mental health of our community. And most recently, they've really been a leader in bringing community-based concurrent disorders treatment programs to populations that are most affected by overwhelming substance use and severe and persistent mental illness. So.
Quand je suis arrivée à l'Association canadienne pour la santé mentale, nous étions 7 employés et maintenant nous sommes 125 employés. Alors, quelle évolution! Quand je suis arrivée ici, nous faisions surtout l'éducation et la mobilisation communautaire, chose que nous continuons à faire. L'éducation était un petit programme à ce moment-là, mais de nos jours, nous avons toute une gamme de formations que nous offrons à la communauté et à des professionnels. Du côté de la mobilisation communautaire, nous travaillons toujours sur des problèmes systémiques par rapport aux personnes qui ont un vécu au niveau de maladie mentale. Alors toujours pour améliorer leur vie et l'inclusion dans la société.
In terms of outreach, it was really meeting people where they were at. So we did all sorts of outreach in terms of, now there's many different divisions of outreach, but at that time there was one division and I was it.
I think it's awesome. I mean, we have such great camaraderie here. Everyone supports everybody else, and if you're having a bad day, there's always someone to talk to about what's going on.
Je travaille auprès des jeunes itinérants qui souffrent de santé mentale, puis de problèmes de toxicomanie, puis je travaille en partenariat avec les services de la jeunesse. Je peux dire que travailler avec eux, c'est vraiment incroyable. On peut aider, soutenir les jeunes à atteindre leurs objectifs et ce qu'ils veulent faire et non ce que nous on veut pour eux.
Communities, it's a good one. It's very diverse. People are funny, welcoming, supportive, and we all sort of come together and help each other out when we're in need. So you don't really feel like a stranger, even though we're sort of a big agency. You know everyone.
CMHA is a great program and I hope it goes on for like ever because people really gain and become more open with themselves and to other people.
Start speaking to people in the office and as I'm coming in, saying hi to everybody. It feels so good and I like it very much here. I feel like home.
And the help I've received, period, from CMHA has been immeasurable.
One of the things that CMHA locally and nationally has been successful in doing is helping bring mental illness and mental health out of the closet so that it's now something that people talk about. And the near future is very bright for CMHA and I think for the people that are served by CMHA. The awareness is increasing and we know that going forward it's going to be based on some of the traditions of the past but complemented by some of the innovations that we've yet to even discover. And we know that that'll stand us in good stead as we go forward.